My name is Browne and I'm a consultant psychiatrist. I suppose I was involved informally, if you like, with MindWise for over 10 years through the Bamford Review, which I think was a very important review of mental health and learning disability services. So I came in contact with Bill Halliday, who was then the Chief Executive of MindWise, and developed great respect for him. And then I was invited to join the board as member of the Trustees, and I've been on the board for the last 3 years. Well, I took up my first post as a consultant in 1988. I had been training in psychiatry for quite a number of years before then, and whenever I look back to my training in psychiatry as a medical student and a junior doctor, things were very different back then. There was much more institutionalised care, and literally the staff were men in white coats, and there were hundreds of patients in the hospital, which of course has changed dramatically over the years, with much more care being delivered now in the community. And I think everybody feels much happier with that move away from the institution to the community. I think the experience of service users has changed a lot over the years. I think it was a much more paternalistic system. Whenever I went into psychiatry, it was very much people were directed and told what to do. I think there's much more of a dialogue goes on now with patients, and there's much more respect for the opinion of the service user. Practices in the sector have changed in a number of different ways. The big hospitals have reduced greatly the number of beds that they have. We see much more in the way of specialist services now, which I think is a very welcome development. We see much more of an emphasis on multidisciplinary care as well. I've seen the introduction of advocacy for service users. Indeed, I've been heavily involved in bringing advocates into the service, and I think that's been a welcome development also. I think attitudes towards medication have changed. There has been recognition both of the benefits of medication and also of the side effects. We've got now some very useful medications that weren't available whenever I first went into psychiatry, that have really improved our ability to treat serious mental illness. And I think there's much more discussion with service users about the choice of medication, the pros and cons of each type, which I think is very positive. I think that attitudes towards mental illness have changed substantially during my lifetime working in psychiatry. There's much more public discussion about mental health issues. You see discussion now on the television and in the papers and so on in a way that wouldn't even have been thought of before. I think that organisations such as MindWise have been very important in helping to shape those attitudes. I think that the Bamford Review, in which MindWise participated, was a major driver for change here in Northern Ireland, particularly in bringing people from different perspectives together and encouraging them to focus on the issue of mental health and to cooperate in a way that I don't think happened previously. I've been involved with MindWise since the Bamford Review, which started in 2002, and I've been a member of the Board of Trustees over the last 3 years. I think that people are starting to appreciate the value much more of the third sector, and we see much more in the way of partnership and collaboration, which is a very welcome development. I think there still is a good way to go, but certainly I think that there have been significant improvements. I think one of the things really that inspires me is going along to the staff awards and the volunteer awards for MindWise, and hearing all the great work that people have been doing for MindWise and to assist and care for service users. I think that's an inspiration.